And if you want to access the recording, I will send it, and you have until the end of the weekend to review if you wish to check it again. So thanks again for connecting. Some of you may know me or some may not, but it's good you are taking the time and look, the exam AMC Part 2, the clinical oral exam, is all about communication, and we want to master the skills or put a little bit of focus, a lot of focus on that. Not only is the knowledge, but it's what we say and how we say. So thank you. I got actually a lot of interest for the talk. Some people may not be able to be here live, but there was certainly a lot of people asking and interested. So stay with the camera on if possible. I see you are all muted, so that's good. Please use the chat to put any comments or ask questions, and feel free to participate, because I don't want to be sitting, you know, like a lecture talking to a wall. The more we interact, or if you get feedback, it's nice to have that engagement. So I don't know if you are the first time that came across the, you know, my post. I don't know how many know about me, but my name is Paola. I'm originally from South America. I migrated to Australia long time ago, 2003. So did public health research, then had a family. And in between, I did the exams, the AMC. I did the second one 5 years ago, and I was able to pass on the first seat after a long clinical gap. So look, a lot of people say, oh, wow, that's amazing. But I did put a lot of effort, and I took like 6 months to only review the AMC Clinical, you know, the handbook. I did summaries, I review knowledge because I had the gap. And then I work in mastering how I talk. Of course, it's easier because I'm used to the Australian healthcare system. So I have the experience from the doctor, from the patient, myself and my family. And I have worked in medical research clinics. So that familiarity with where you are and the culture of Australia, I think, is very important. But yes, knowing the tricks, I always say, and I do some tutoring now. I'll show you a little bit about the course that I also have online summaries at the end that is self-paced. I always say that the exam we're not testing who has, you know, the credentials, the experience, or the knowledge, but it's more about how you talk and what you can show in those 8 minutes in each case. So I say that it's like the acting out, and you prepare the script, you practice the script a lot, and it has to be autopilot, because in that time frame, there's actually no time to think. It has to come naturally. And we all are not natural speakers. Communication is not the strength of many of us. We are great academic minds. We know a lot of facts. We have a great knowledge, but I come across, and now that I'm doing one-to-one sessions, a lot of people struggle to have that patient interaction. As I said, the English, the same, is an issue for many because it's not our first language. And the cultural differences, there's a lot of stuff and barriers that could prevent, or that can cause the situation that we see every day, that this AMC clinical exam has a very high failure rate. And most people are prepared to just sit a few times until they actually pass it, but it's rarely, or not many, will be able to pass. So I did put a lot of effort. I also work a lot on my mindset. I think the mindset, being positive, keeping confident and trusting that you will get there, and that a higher power goal, or whatever you call it, is on your side. So I did have counseling for the full year that was preparing, because that was my strategy. Focus on talking. I did a lot of talk aloud on my own, recording myself doing the cases, checking the time, being very aware of the 8 minutes, how long it really takes in real life. And that's another, probably as a separate talk about time management and all. But today I would like to focus on just sharing from my perspective. This is just my side. You take what you think is helpful. We all have different experience backgrounds. So please take what you think is useful. What involves communication skills? So there's a lot of stuff, and this is just a picture to put that in an image. In this exam, we want to show that we listen to the patient, and that's the active listening. We know what's happening. We listen to the words, but also the body language, how patient present, or the carer, whoever you are interacting. They want to hear us giving patient education. Here in Australia, they put a lot of emphasis in that prevention side, social context, checking all the holistic approach and how much we can educate and support the patient in whatever his illness or complaint is. We want to show the compassion, empathy, and also build trust, because we will see how communication skills is very important. And every day you communicate in life, we're always telling ourselves, pretty much, we're always offering and exchanging a conversation with our loved ones, people at the jobs, any job. There's always we cannot be as human beings, we need that social context and interaction, and we are always communicating. And the better we do, not only with the patient, but in our real life, partner, kids, the quality of your life and that area will improve a lot. So it's something to keep in mind, that this is not only how to be good at exam, but you can also, keep for real life scenarios in other areas. What happened with the health practice? Just a general context. As medical practitioners, we do treat with people that is feeling sick and well, concerned, and they need more support. They have more sensitive needs. So it's not a machine, it's not a computer or just exchange of information, but it's actually the two people, and we need that to get a better outcome for the patient. I read an article, and it said in a couple of different places that I was looking for when I started doing this presentation last week, that it says that medical legal issues and all the ethical problems is not about the knowledge or error, but it's more about miscommunication. So in real life, that's why we need to focus on this. The treating patients, not only about, we only focus on the treating the patient, treating the symptom. And I was talking to a person that was inquiring about my support, and he said, look, I'm so busy thinking about the task, I'm so busy thinking that the time is running out, that I forget about the person I have in front. And it totally makes sense. It's very stressful, and only when you sit the exam, or you can prepare and think how it's going to be, but it's only when you are there that you see all your body, physiology, everything changes because you are under a lot of stress. But you want to keep that person, show that you are caring for that person. So what happens if you don't communicate well? There's patient dissatisfaction, there's more complaints. They don't care, so they won't follow your advice or management plan, because they didn't have that empathy, or they didn't build the trust. So how can you do that? There's three main things that is listed here. The active listening. Really listen to a patient. We don't have time. We have a script in our minds. We have a list of tasks. We had 2 minutes to prepare in our head what we need to ask, what we need to say, what could possibly be the differentials. But when we get into the room, we need to keep that in a side, but actually listen to what the person is saying. Sometimes it happens in any relationship or interaction that we have, that we are already thinking of the next question, or we are really assuming or making things in our mind without listening. So it's about just being present, fully focused, show the empathy, a lot of emotions, be aware of the emotions, and using the open questions. We don't have a lot of time. This is never going to be enough 8 minutes to do a real consultation, and in general practice, here is 15, and it's not enough. The system is always putting pressure on doctors to see more people, and unfortunately communication is lacking in real life. But here we want to show that we know how to do that best, being present, showing that we care, and also open questions to begin with, and then you will be able to close and get the conversation on the way that you want, depending on the clues that you are getting. I always say that history taking is the most important part of this consultation, because you are a detective. And if you miss answering the right questions, you won't get to a diagnosis. You won't get to take those differentials that you had in mind, exclude some, or get others. So I think those, the questioning, you get the diagnosis. You can also consult appropriately if you know lifestyle choices, what are the barriers, what's happening in the, areas of the life, is stress is a factor, and create a plan in that way. So not only when you communicate, you can provide more, like the patient can understand more the information, but you can also identify the needs, expectations, what's really happening in that person's life. And in that way, you want to get, get that patient satisfaction. We already said this, so a lot of complaints is actually because of the communication issues. So when you put yourself at the other side and you are a patient, or your partner is sick, you have a child sick, how do you want to be treated? What do you expect from a doctor? So I want you to quickly think about that, and if you share, that would be great in the chat. But just let's think about being on the other side. What do you want to expect from a consultation when you are feeling ill? So it's just let's be empathetic and feel like we are on the other side. It may be a different experience from your home country. But yes, here I was surprised when I first arrived, because in real life, the consultations are 15 minutes. The doctor don't even examine the patient, probably blood pressure, and that's it. In my country, we had the full assessment, there was more time. So there's a lot of things that is shocking. But yes, there's always the rush. They ask, do you have one complaint? Because if you have more, it's going to be 30 minutes consultation, and you have to book like 2 things, and you have to pay more. So yes, the doctor to listen to me, don't feel rushed. Yes, so that listening, patients love, like as a human, we love to talk about ourselves. If you want to make friends with someone, just let them talk, because always people want to talk about themselves. They love to be here, and that's a basic human need. We need attention, and we need to talk to someone. So when we see a professional, health professional, we have a need, a clear need, because we are seeking that. And we also sometimes have that emotional need. We are looking for that caring figure that may have the answer to our problems. So you may have a different cultural background, and you will see that it changes when you come here. The system may not be the same. So I do want people to comment on this, because I want to see what are your, like, why are you here? Why do you think you struggle, or why are you worried that are the issues that it may arise in terms of communication skills? So what do you struggle with? So please take a moment and put in the comment. Is it, you say lay language, that do you forget the lay language? Okay, confidence. Is it that you struggle because you are too worried about the time? Okay, asking the relevant questions. Yes. Time management is huge, and yes, the confidence. I think that's why I say we need to think and do the exam as you were acting out, and you are going for a, for the, you want to get the main role in the performance. The role play patients are acting out. You need to also be acting out and just do your best. One way that I did that, just put in I want you to, if someone else wants to respond this, I'll wait as well. But yes, with the confidence, that can also be an issue. I used to think about a mentor. If you are working at the moment in Australia, think about your supervisor or a senior doctor or any professor that you had in medical school, and you want to emanate, copy them, or just find someone who acts with so much posture, confidence, that feel they know everything, and just try to behave like them. I know it's not natural for a lot of us, but as I say, this is not about, you need to be authentic in a way. You need to keep the words and the language in the way that it works for you. You cannot, like, I do have audios in my summaries, and I do within the time, 2 minutes history for this, 5 minutes history for a full history on that, to practice, and they get the autopilot about the questions that you want to ask. And you cannot always copy my language. That's the point. You need to keep being yourself and showing your personality in a way. But if there's some qualities that you can copy from someone, is that confidence, and find it in your industry, in your professor, or someone that you admire. But yes, just is the acting, I would say. I love this book from Stephen Covey. That is, it's actually 7 Habits for, it's about all communication and leadership. 7 Habits of oh my God, successful people, something like that. I have the bookcase just here next to me. I read this many years ago when I arrived to Australia, because I was working in personal development as well. And this came to me when I was preparing the talk. So I think, sorry, it's begin with the end in mind. And it's how you want, in this case, we're going to address about the exam. So how do you want to perform that day of the exam? You need to understand how you want to behave, what you are going to show, and what you want to, the characteristics of the person that you want to be on that day. That's the acting that you are preparing for. And with that in mind, you can prepare, practice, and try to copy those skills, or the way you sit, the way you talk. All those little things that are verbal and not verbal are important, and I believe examiners are looking and checking that. So if you are thinking about beginning with the end in mind, and I also do have a lot of mindset resources in my course, because I think that training the mind can be our main enemy and a big challenge. So the more you train your mind to be confident, you can work on that. But I do have a visualization about how you actually, like, imagine you are the day of the exam, you are smiling, you feel confident, you are ready, you are asking questions, patients are cooperative, examiners are kind of smiling, or they try to keep you motivated as well. So the more you rehearse that exam day in your mind, is also helpful for that communication, and to imagine how you want to show up that day. So I'm not allowed a lot of time, but as I said at the beginning, if you want, I can send this replay until you have time until Sunday to watch it, and do some journaling. How do you really want to be perceived by the patient? What do you want the examiner to think about you? How do you want the patient to feel by when you leave the room? Because this is important, and we usually are too rushed into checking all the materials, all the latest records, checking the cases. Oh my God, I don't know this case, I have to check this topic. But we forget that the exam is actually testing that you are supportive, caring, safe doctor, but it's all those communication skills, not only really, not really the knowledge, because we are at the junior level. It's just about, the interns and junior doctors in Australia. So we don't need to show that we are specialists. A lot of you, I know, have 10, 20 years of experience in a specialist field. And yes, it's a pain, it's frustrated that they don't recognize it here, and you have to pretty much start from this part again, but they want to see that you can communicate, that you are safe, that you can work, in the system, and make the patient feel okay. So anyone want to comment here? What do you actually want? How do you want to be perceived by the patient, the examiner, in terms of these communication skills? Okay. I don't know how I came to this, but I remember when I was studying, I used to think, or someone gave me this tip. But if the role play patient that you are going to interact with was your loving mom, dad, or someone very close to you, how would you treat them? I think that's a really good question to keep in mind and to ponder about, because it's that how would you perform to show that you are really caring, that you communicate, you want to, like, I'm going to give you some tips as we go through. But if someone you care and love is in front of you, and they are sick, they are angry, frustrated, really ill and well, you want to treat them in a way that they feel supported, listen. So these are things that I just put together from what I think is this, and read some articles about communication as well. So what someone said earlier, so you want the patient expects, what kind of the patient expects from you? To be listened. Sometimes people say 3 times the same thing, and when I practice role plays, I sometimes give the clues like 3 times, and because the doctor is so focused on asking the next, or making the checklist that he has to go through all this history, he doesn't listen that I say already 3 times, come on, like, go this way. If I'm talking about this, and if I want to talk more about that, is because there's something going on there. And patients, role play patients, are normally cooperative unless they are a maniac patient or depressive patient who cannot talk too much, and it will be more shy in a shell. But usually they want you to do well. So imagine that they do want to support you, but you want to make sure that they get that you understand their concerns, and you are also reassuring them during the consultation. You want to make sure that they are engaged and participate in the conversation, because sometimes, because it's the 80 minutes limit, some doctors feel that they need to rush and talk too fast, and they forget to say, oh, are you okay? Like, are you following me? Do you have some questions so far? So it's just breaking some pauses, taking a breath, and allowing to see if the patient is getting and following what you are saying. So I hope it makes sense. Patients also want to be explained the concepts in very simple words. Sometimes we struggle a lot because we normally, examinations and assessment are to examine it, or you are just being tested on the knowledge, the way to talk. But here is using that very simple language without any jargon. Sometimes the task in the examination, as I said, the 8 minutes is never going to be a full consultation. Sometimes you are going only to do history taking and then diagnosis, and that's it. Explain diagnosis with reasons. And you feel like, but what's the plan? You want to treat the patient, but this is not about, you are caring, it's a role play patient, care as if it's a person itself, but you cannot expect to, to finish and to do all the management plan. So I'll stick to the tasks and give the information that they need to know and that they expect to know. So wouldn't get into all the management and all the consequences and the different options. No, just stick only diagnosis and that's it. But yeah, sometimes we feel that we want to rush, and because we know so much about the topic, we want to cover all. And what we do is overwhelm. It's so much, and it's not necessary at this stage and for this exam. You want to feel the patient supported along the way, that they are safe to speak. So it's a safe container. That's when the confidentiality agreement is very important for some cases, especially all the mental health, psychiatric, and also some most women's cases that you are doing with sensitive matters or just any sexual health. It's important to give that confidentiality agreement. Just be safe, this is a safe place, whatever we talk between you and me is confidential, unless you or someone else is at risk. So there's these little scripts and sentences that you need to put here and there, and you are covered, and you show that. As I mentioned before, and I will keep reinforcing, we are treating with patients, with persons, and it's not only the hand or the elbow that is broken, but it's we all know the biosocial component and emotional needs as well. We also want to address the patient in a polite way to show the respect. They want to feel that that you are confident and you know what you are doing, so they can trust you. They also want to know the truth, if it's bad news or whatever is going on. They want to know what's happening. They want you to know the same. As I said, the unspoken word can give you clues. They want you to know the emotions, and that you need to validate and just show that you understand what's going on and respect that space. As part of this exam, there's also, like, you need to remember that you are not alone. You are the junior doctor, and you can always call to her. You can always call a senior in the hospital. You can always make a referral. So this is a good point for any case, that you show that there is always a team of specialists or professionals that are able to support the patient in whatever need they have. As I say, we are actors in this exam. We all have the knowledge, plenty of experience, so more than other, and some is very specialized experience. So we do feel that we have gaps in some topics and subjects, and we can get to those gaps. But it's more about what we translate, what we know, and put it in words in very simple terms. So we show that we are caring for the patient, we are doing the right thing, because we need to be safe. It's not that the knowledge is nothing, but it's more about, I'm sure everyone here passed the MCQ, we all have the knowledge. It's more about how we translate what we know and give the answers they want to see. I don't fully understand how the examiners mark. It's very confusing, the feedback that you get when you sit the exam. And that's a, yes, it's different words. Sometimes we don't actually know what they are marking. So you want to make sure you do your best and cover, yes, show up yourself the best way you do, because sometimes it's very gray, or we don't know exactly what they are after, unfortunately. But the communication skills and how you show up is very important for sure. So it's a mix, and it's to create that balance between sticking to the tasks, knowing the time limits. I usually tell my students, just put a timer for 8 minutes during the day, so you get used to how long is 8 minutes. While you cook, while you walk, while you eat, you need to know by heart how long is 8 minutes, because 8 minutes for the exam, like, you need to do 16 cases of the 8 minutes. So you need to know how much in real life that lasts. And it's not too bad, but then how you manage, if you know how to manage and you practice in the right approach with the right logical order, and keep yes, that structure in your head, the 8 minutes it's enough. Otherwise they wouldn't put it. So while you answer the tasks and what you communicate in simple terms, you want to create the best positive experience for everyone who is in the room, for everyone who is seeing you on the online camera if you are sitting online. There was a note I read from a paper yesterday that says that you only want to give the patient the information they want or need in the way that they can understand. Look, this is all very common sense, but sometimes, you know, we forget, or we find it hard to, yes, we struggle to actually make it in an easy way. The stress is therefore, yes, a very important factor, and it messes up with all of us. And even if you prepare to not be stressed, you still feel the stress, and that's normal. But it's more about keeping that under a normal, like until a level that you function, because you need to be, yes, functional to do the natural, you know, so it becomes natural. That is scripted as the acting that I said. So what you want patients to say. So what do you want patients to say at the end of that interaction? How do you know if they are happy? Like if you give them the best positive experience, we talk about the trust, showing that you're confident and you know what you're doing, you are empathic, you are caring, you are addressing the concerns, listening to the emotions as well. At the end is how patients perceive you. So, and this happened. My husband was sick last month, and he went to the doctor and he said, "Oh, I didn't like the doctor much." Then he had to go again, and he said, "Oh, I like this doctor. I want to, you know, make keep the name and the business card because I think I would like to come back here." So it's the same. You want to create that experience that the patients want to come and see you again, because the doctor get me. He actually understood my concern. Okay. So if we were discussing this the other day with a friend who was sitting the exam last week, and I don't know if it's true, but I have heard it before. So imagine if everything that you do during the 8 minutes comes to one thing, and is, so you finish, you did all the case, you bell rang, you move to the next room, and the examiner has a checklist. He's been taking notes, you know, all the, yes, assessing all the different tasks and the domains that they check. But what if everything comes down to a question that the examiner asks the patient? How did you feel with this doctor? Did you feel taken care of? How satisfied are you with that? Imagine that it didn't matter how much and how well you asked the task, but how you made the patient feel. Look, it sounds funny, but it's to the point that this really is important. So that's why I wanted to make this talk, because I normally share information in posts. I talk to people that we're doing the one-on-one or the small group place, and I give small pieces of this. But I think making this talk as I am, it reinforces that patient satisfaction and the positive experience that you can create in those 8 minutes is important. And yes, at the end, this is also from a journal. How satisfied a patient is at the end of the interaction depends on many factors, but this is the measurement of healthcare delivery systems, and this is how they do a lot of surveys, and there's questionnaires about that client satisfaction. And this is, yes, and because the client satisfaction will also mean that the patient will follow the advice, adhere better, come back for a review, is very important. And I do think it's important that you take it in mind when you prepare and when you sit the exam. So we know the clinical knowledge is there. Yes, I have talking about it, but it's more about the clinical reasoning, your approach, having a structure in mind, and how you organize all your ideas, that busy mind, and communicate what they want to hear. As I say, just be caring and show patients the most respect, and and care about them by explaining with easy terms. But I also think that that structure, that order, and whatever you say is also being assessed by the examiner, because they also have a checklist that they want to hear. So you want to be ticking those boxes, and in a lot of things is just we're going to go through the different stages of the consultation and with some examples. But look, this could be a full 4-hour session, but I just wanted to do a quick overview. And I hope so far it's been, yeah, something that adds some value to you. So I also talk about this. And the system itself, you know, cardiology, look only this. The urologist, look only this. I don't know, the eye specialists, everyone, we specialize in an area and we only see that part. We forget about the rest. But we are not treating with a part, it's not a machine, but it's a person, as I said, and it's all that component of what the patient is feeling, thinking, social support, they have cultural beliefs, and yes, the background. So everything is important to recognize, and this is for life. Whatever you do in your future careers here in Australia, I hope that you all have great success, but remember that we all are persons and we do need to address a lot of things. Unfortunately, the system, yes, doesn't allow that because of the time frame different and all the admin support and the rush and the number of patients that we need to see. But in the ideal world, you want to care, and the only way you care is when you see patients as a full system. So how is everyone going so far? Just because I don't see their faces and I feel that I'm talking too much. Quick check in the comments. Learning something good, finding this valuable. Okay, thank you. So I'm going to now give some examples in those sections on the kind of the areas of assessment when we do get into a case scenario, different ways that you want to that you can in easy ways, because this is not complex. I think it's a lot of common sense, but we take it for, yes, we don't give the value to these little things that actually mean a lot. So welcoming the patient, greeting by the name. That's also something that I learned with Stephen Covey or someone else, like one of those mentors. The name is the most beautiful sound for someone's ears. So knowing the name of someone is very important in any relationship, in any conversation you have. So if you remember the name, they will like you. And here, if you have the name in the case notes, of course, use that name. If not, check. Always introduce yourself. There's many ways that you can do, and you all have a script and a natural way to say, this is Paola, I'll be your doctor today. And, you know, identify who you are, the GP, the junior doctor, whatever your role is. The other day, a student who did the exam said, oh my God, I was always preparing, hello, my name is this. Say, hello, Thomas, this is Paola. How can I help you today? I'll be your GP. And she was shocked because the first thing that happened once she got in the room is that the patient started talking. And she was surprised, oh my God, this is not the way I planned. So always be prepared for surprises, and the exam, you can have an understanding, you can get experience, or you can ask friends who have done it before. You can get my experience because I have studied and I'm now teaching and you know, supporting others. But sometimes you don't know exactly how it's going to go. So the patient started talking, and then she said, oh my God, I totally lost everything because I was supposed to be starting. So look, anything can happen in that room, and we need to know and be super flexible and just keep casual and keep going with whatever you press. Like, you don't know how you're going to get, like, you know the topic, you know the complaint, but you don't know who is going to be in the room and how they will be behaving. So just make sure that you do your part in whatever order it is, ensure the patient readiness, they're ready to discuss. Look, I'm going to start asking some questions so I gather more information and I'm here to help. This is the safest place, confidentiality if you need. Eye contact in the room, in the Zoom camera, sometimes in the face-to-face. And I've also heard this, and it's hard because you have the patient, you have the examiner, you have the task in the computer upstairs, and there's so many things, but you want to focus on the patient if you are talking to the patient. If you need to get examiner information for physical examination findings, just make a little transition. So use a sentence. Mary, excuse me for a second. Thank you for the information you have given me. I'm now going to check with the examiner about the examination, or I need to check first with the examiner about your vitals. So you tell them that, sorry, I'll be away for a second. I just need to address this other person, but don't give the back because that's rude. And look, you are stressed, you are rushing. So you want to, yes, you don't want to be rude. It can happen. And I think a lot, of course, all this is unconsciously. It's not that you intend to be that, but because you are under a lot of pressure. But it's just a simple thing. Thank you so much for that. Thank you for your cooperation. I now need to talk to the examiner. Thank you, examiner. I'm going back to my patient. So it's very little things, but it makes your life better and you create better experience as well. So history taking is one of the parts that I love the most. And look, I wanted to do a class only on history taking because I think we are detectives. Our job, and in real life, our job, we need to ask questions to know what's happening and to get to the root of the problem. And it's only by the information that the patients share with us that we can actually figure out or have an understanding what could be the problem. So always check. Sometimes you can say, okay, I understand from your notes, this is happening. Is that right? Tell me more about it. Just open questions. So what's going on in your life? Why did you come to see me? Like, you don't need to repeat all the information. Most of the times there's teams at the outside the room. When you have 2 minutes, you will get a lot of notes. You don't want to waste time repeating everything, but just quickly checking. Okay, so I see you come with your daughter because she's been coughing. Yes, doctor. Okay, tell me more about it. So what else? Just let them talk, because that's the most important part, and they will give you a lot. If you let them, you don't want to let them talk for a long time, so you also need to have that balance, but they usually won't be talking a lot unless they are the maniatic case or any problems, psychiatric problems. But just having a clear history taking around the presenting complaint, and then you can facilitate or get the other information. Okay, so tell me more about this. How is the pain? How would you describe it? Where is it? And all the, I use the Socrates acronym to find out about the information about the pain or whatever the symptom is. So I'll be answering the questions if I can at the same time, or not at the bottom. Thank you. Okay. So here, explain, yes, once you cover the present complaint, ask about, okay, what else? System review. Have a quickly associated symptoms and check what else is going on, social, emotional part. If you need to clarify, so is this right? Was this the order of things that happened? Am I missing anything else? What else? And also check and validate the emotions. So thank you for appreciation. So there are some examples here on the right. But yes, let them talk at the beginning is important. Oh, that must be very terrifying. Oh, I believe that's frustrated. Or yes, it's not always say I know how you feel, because you don't necessarily need to know, but it's validating that emotion. So there's a question here in the chat. If you do have the card in the room and you can refer to it, to check that you don't have any missing tasks. You will get the same information that you get outside. All the case notes and the tasks will be available to you during the 8 minutes in the face-to-face on a screen. I think usually is behind where the page, like you can see it, but it's up above the patient's head or to a side. Like it won't be on your back. It will be on your visual field. And on the internet, my understanding is that you have access to that card. But I did face-to-face, and in most cases, because of the pressure, the stress, and because you have the person sitting in front of you, I didn't have the time to be scrolling up and down and reading the whole thing. You can say, excuse me, I'm just quickly going to check. I'm sticking to my task. I'm just checking what else I need to do. But yes, I couldn't do it much during that time because of the stress, the time, and because you have someone engaged. So you want to be looking at the person, you want to be focused and present for them. So you will need to, make some notes. So excuse me, quickly check. But look, that's different for everyone. Probably for some it's easier. More on emotion, so explore. I can see that might be hard for you. Sorry, this is happening. I hear that you are saying this is going on. I get your point. So this is just some ways as well to know the feel that like that. Yes, you are putting in words that empathy, compassion, and the caring that you want to show in this performance that we are doing. So there's different protocols. Today I was looking for more for final revision, and I found some more things. This is the famous spikes that I learned in the Geeky Medics. If you're familiar, I love that site, and I usually refer a lot when I'm tutoring people. And it's having a scenario, knowing how to give out the information if it's a bad news, pauses, short bits at the time, make sure the patient is in a safe place, invite and just check how much they know, what are the understanding, what are the expectations, how much they want to know, if they want to call someone. So there's a full thing, and then summarizing, addressing the emotions, and then giving a strategy and a plan to action to go slowly, bits and pieces. So you can review that. So physical examination, this is also something new that comes for like different in the online examination. You don't have the patient in the room. You do need to explain exactly what you're going to do, but you don't need to get into too much detail. So there was a case, if you have a carer that has a child with cough, you want to explain to the dad and gain consent. Look, your child has some cough, respiratory issues. I'm going just to tell you that we'll be looking first at his general state, check if he's dehydrated because he hasn't been eaten. I want to see the color of the skin, if he's pale, if he's bluish. I want to check ears, if there's any sign of infection, say with the throat and nose. Then I'll be listening to the chest, looking at the heart, also auscultating the lungs for any sounds. I'll quickly and then check the abdomen. So without getting into details and too much technical or language or jargon, you want to quickly just give an overview. The same with women's health, if you are doing pelvic exam or abdominal health online, and with the patient, it's just a simple explaining what you're going to do, get consent, ask them to prepare. Always remember to wash hands before and at the end of the physical examination. Mention the chaperone if you're seeing a lady or a man, and yes, like the genitals or any private areas. And in simple terms, so people is comfortable for, of course, to allow the examination and to know why you are wanting to examine. So moving to the next section, this is very important, and I think a lot of people are failing as well, because in saying that we don't need to show all the knowledge, we do need to show the clinical reasoning, and that's what you think is going on, and having a list, because it's not only getting to the accurate diagnosis, but it's what are you considering before you get into the room. You need to have a list of differentials, more than 3. And during the 8 minutes, your task most of the time is to ask questions, do the examination, to tick what of those differentials is most likely happening in the patient. So you want to know how to explain that, and the task doesn't say discuss differentials, but it says explain diagnosis with reasons. So that's the same, like what's going on in your mind, what were you thinking when you first read the case, and what's your most likely conclusion so far with the information that you have, because you don't have all the information, you don't have full examination and all the investigations, but it's more about how you organize, and we do practice that, and there's different ways of saying the most likely diagnosis is this because this and that. I was thinking also about that, but you don't present with that, or the examination was normal. Always check that you are in that differentials, you are considering the most serious conditions that can be life-threatening, or that you don't want to miss, because that's part as well about being safe. But you want to explain, and sometimes you want to explain depending on the task. If you are addressing the examiner or if you are addressing the patient, you will use different terminology. But you want to say, okay, I was thinking about this, but it's actually not, because of the history of physical examination is pointing more towards that. But when you have this presenting complaint, I usually have this. So you have a big, yes, not big, but a good list of different things that you were considering. Okay, thank you for your time. We are nearly at the end. So when you're closing the consultation, a lot of people not necessarily need to close in a particular way, depending on the case, the patient, and the tasks. Unfortunately, a lot of people want to close, but they don't have time because the bell rings. And I believe this is also an important part, and the way you close, of course, will create a better experience, because the patient will be more satisfied if you were able to give all the information you wanted to give. So it's always the balance, and it's always how much you ask the questions, how quick you get to the examination, and it will depend on the tasks. You will need to assess in those 2 minutes roughly and in your head, because you cannot take notes in the 2 minutes outside in the face-to-face or online. You are not allowed to write down, and that's something else that people is, oh, I didn't know that. So those 2 minutes is thinking time, looking at the case, looking at the complaint, and looking at your tasks. You need to know, okay, so focus history now is going to be here no more than 2-3 minutes. Then I have to move to examination, and then I need to do this. So you need to have a plan before you get into the room to know a little bit about how you are dividing the time into those tasks. But if you do the things right, you should be able to finish, otherwise they wouldn't do it. So there's a few things. I remember I did the 5 R's, and I was doing this slide and I forgot one. So you want to check that always there's an understanding. Are you following me? Are you with me so far? Do you have any questions? And allow them to ask, because most likely some, in the script, they also have a script, and they do need to ask some questions if you haven't covered that. You also need to, yes, so the 5 R's. There are always some cases. Oh, yes, you have alcohol problems, so we need to address somewhere else. I see that you have problems, relationships or lack of support. Let me make another booking because I would like to talk about that. So that there's never going to be an opportunity, and you don't have to address all the concerns, but it's good that you are aware they exist and you care about that part as well. So you want to reassure the patient, you did the good things, that you are in safe hands. this is something that, like, you know, it's a benign thing. It's not serious. Don't worry, or explain if it's too serious, and show that, make that emphasis. Look, this is serious, but still you are reassuring. If you need to refer for investigations or for another specialist, you want to do that as well. They always like that you give reading material. So whatever you are talking in general practice, most of the time, not necessarily if you're admitting the patient, but if patient is going home, you want to say, look, this, of course, there's a lot of information I would like to give you, but there's no time. I'm going to print out some recommendations and some things for you to review about this topic. You want to organize always a review and a next follow-up. So those things, I believe they tick and they want to make sure. And if you run out of time, of course, the closing doesn't look good on the bell, and then you, oh, so much I knew about that, but I couldn't, you know, communicate and translate. So I think it's all about practice, and with practice you can master any skill. Whoever is expert in something is because we don't know the backstory, but they put amount like crazy hours. The other day I was talking to a friend that the girl does ballet, and she said, look, the solo dancing is 1 minute, but you have no idea how many hours and hours she has to do the same thing just to go on stage for 1 minute. So here is the same. You have a lot of cases, 16 cases, it's 8 minutes, but it's a lot of practice. So I always, my recommendation is don't rush to get a date for the exam unless you are rushed, that you are already working, limited registration, they need to have that second exam. But if you are not very familiar with exam, you have time, you are stable in a job somewhere else, or your family can support you, don't rush to get the date because it's expensive. And time is also expensive as well, like the time you waste and then resit the exam or come or travel. So yes, practice and put time. It's not easy. We all have lives, responsibilities, and this is something on top of the normal life. But if you get organized, you can make a commitment and follow a plan and be consistent to actually study. And look, that's why I'm also here to support those people who need that hand, like, you know, hand and support. This was a little article from another website. And how can you know how you're doing with the communication? Be aware. You can ask patients, colleagues, someone who knows you, what impressions are you making? Are you rushed? And the same with the role plays that you do with your other study partners. How do you feel? Oh, you were rushing too much, like make a pause, remember to breathe. Oh, you are not looking at the face, you know, you're not present. I see your mind is thinking about the next. So get that feedback. You can observe yourself, you can practice in front of a mirror, record yourself in the camera, record yourself talking aloud. Am I clear? Did I explain in 1 minute what these diagnoses actually mean? Did I give the information they need? So it's a lot of trial and error, but it's practice, as I said. Observe yourself, and third, decide, okay, what do I need to do different? You cannot say, oh, Paola, you are doing so bad, like you have to start, you know, new person, new approach. Making slowly things and adjustment a little bit, you will get better and more towards that, you know, that, as I say, emulate, copy, or someone that you are inspired by, or a professor, or someone that you love, the posture, this and how they talk. But slowly you will be able to accommodate and master your skills, because we all are individuals. You need to keep your authenticity, as I say, and show your personality, but you want to be copying things that you think will be better in a way that you will be able to show that positive experience, to create a positive experience. Okay, So I think I gave you a lot of information. If you have some time and you're here, I would like to just to get some feedback. How did you find the information? Is it useful for your studies? I know it's not too much about the content, but it's in the how, and see if yes, how you like it, and if it's useful in some way. So please, happy to talk or happy to put it on the chat. I'm going to stop the recording here. Actually, let's put it on. I'll leave it there. So I just quickly show you exactly. Very helpful. Thank you, Doctor. So a little bit about what I'm doing. I do have an online course that is pretty much my summaries. I did take 1 year off. The first 6 months were only reading. And I remember I sat at the library all day, went out to have lunch across the street from the pub, and then study, because I did have that medical knowledge gap. And I also wanted to understand the exam. So I put a lot of time in understanding what the exam was. And I say I have a YouTube video, which I did just after I passed the exam. And I remember saying I would like to be able to interview people that pass, because I know they have a trick. There's a trick and something that is unique. But if you understand that it's all about the communication, you will be able to do it better. So I simply start sharing my resources of the summaries, and I now do it in a nice format, very organized. And I do have a lot of the audios that I was actually, the audio scripts that I was compiling for my studies, and I made those available. I have uploaded more stuff, and there's also slides, critical audios, and there is also role plays or recalls of role plays that we do in a group. So I think the most important bit, as I say, is talk, talk, talk. You cannot sit and read the handbook. You cannot sit and read the Marwan's notes or the current notes, whatever you use as a source. This is all about talking, making errors, and getting better. So I do have a space Tuesdays and Thursdays, 8 o'clock, where I meet no more with 5 people. So everyone can do at least one case. We all discuss, they get feedback, and we work in a schedule. So we're starting again next cycle next week. If you're interested, I still have spaces for 2 people, and you're welcome to join. It's super affordable. It's like $16 for each case, and it's 90 minutes that you get to review recent topics, and we work on this. Some people don't work well in groups. Some people are getting to the exam very close. They are ready. They have been studying for a long time. They just want to check the approach is right. They want to check or work on time management. They have a weakness in, say, women's health. So they want to allocate some time for one-to-one. I also offer those, usually 90 minutes. So people say, I want more time, like 90 minutes is not enough. I like long time to study. Okay, so I'm also doing 4 weeks sessions. We have a 10 minutes break in between, but we work on whatever, like I'm totally there for you. And depending on your needs, we tailor the session, and it's working really well for people who is doing that. And the same, similar to those 4 hours, we run a online test that I do under the same conditions. You do 4 cases back to back, break 4 cases, and then we have overall feedback. And I also record. I love recording myself because it's easy. So I do create an audio with detailed feedback for each case, and you get to review that. So if you find that you need a hand, or you like my style, you want to know more about the course, there's my details at the bottom. And the easiest thing is to follow me on Facebook on the AMC summaries. I have, what else? Look, I may be doing more talks like this every month or so on. I do want to hear what will be interested for you, like time management, mindset, stress. So depending on what I see, if there is some interest, I'll be doing this. So if you haven't sent me your email, because I know some of you contact me on Facebook, and we just exchange the details there. So send me the email so I can invite you for future talks like this. I can send you some resources. I do have a study plan, some audios and some videos on YouTube. So the group sessions at the moment is Tuesdays and Thursdays, 8 p.m. to 9:30 Melbourne time. Everyone is from different places, so I just say 8 o'clock. I have someone who has connect from South Africa, from Jordan the other day, but usually it's more about Australia. It depends where you are. Some people overseas are able to do it as well. But yes, I have a couple of spaces because we want to have a small place, safe, and when we feel, secure to make mistakes. At the moment, that's the time that works for me and what we have been able to accommodate others. So thank you again for sticking to the end. Any questions? I'm here to stop recording.